Hi, my name is Dr. Forrester Dean. I am a chiropractor, physiotherapist, and primary care physician practicing in Manhattan Beach, California. In this episode, we're going to discuss download number 7, special imaging, MRI, and X-ray. So please go to the website, betterpatientsolutions.org, click on the Services tab, scroll down to where you see the interns. Under Medical Networks, you will see number 7, Special Imaging, MRI, and X-rays. Underneath there, you can scroll down to see the download. Go ahead and click the download. And here it is, print the download. And here it is. So I created download number 7 because I believe that patients have an idea, and I did too once upon a time, have an idea or a perception that there's some sort of magic, or there's a magic story, or MRIs or X-rays are going to reveal some sort of secret story about what's going wrong with them. And the reality is that in most cases, an MRI or an X-ray isn't going to do anything more than just confirm the diagnosis that the doctor should have already made to begin with. So download 7 is about empowering the patient to be an advocate for themselves by understanding that there are only certain cases where the cost and the time involved in getting special imaging, such as an MRI, an X-ray, or a CT, or a scintigraphy, or a PET scan, are really required. 90% of the time, your doctor can get all the diagnosis that they need from your history and from your in-office exams. So the benefits of using this particular worksheet number 7, the doctor will understand your values and expectations about the best patient-doctor relationship. You help the doctor steer your case in the right direction. The doctor sees you as a whole person, not as an illness, disease, symptom, or medical condition. So honestly, if the doctor takes an MRI, they're just going to see your anatomy. They aren't going to see your values. They aren't going to see your lifestyle. They aren't going to see your expectations. They can't see your occupational demands. They can't see your emotionality, right? And those are the things that make you a real person. So what I want you to know specifically about this download here is that I have created 9 really valuable, I want to call them like medical backstory secrets about MRIs and X-rays. And the 3 most important ones I want to tell you about: the medical picture, which is an MRI, X-ray, CT scan, for example. When it's not a traumatic injury, when it's just chronic pain, never explains everything, nor the only thing that is causing the pain. So typically, for a common complaint of pain, body pain, joint pain, even muscle pain, it's a cluster of problems. It involves muscle, it involves connective tissue, tendons, ligaments, nerves, inflammation, overuse syndrome, a variety of things. It's never one thing, and it's certainly never one thing you're going to see on a picture, or a picture, what I call like MRI, X-ray. There are many things about the body that a picture can't explain. For example, you can't see pain. A medical picture can be taken only to support a diagnosis, never to make a diagnosis. So listen, if you have a doctor and the doctor never does an exam, and they don't look like pick up your shirt and look at your low back pain and touch it and feel it for muscle tone, for tension, and have you do some certain exams, right? If they don't do any of these things, then they're counting on this picture to diagnose you. And that's not fair to you as a patient, because it doesn't explain the full picture of what's happening for you, the scope, the total scope, what's called the clinical picture of you, right? So, and then the next part of the worksheet here for number 7, there are 7 questions here that need to be answered by the doctor. And the most important one that I think is on here is, if you don't take the imaging, how are you going to explain what's wrong with me? Right? And then the doctor panics because they don't know what to do. Okay, so in that case, you need to say to the doctor, okay, I understand that you can't prevent a diagnosis by making me get imaging. You still must be able to diagnose me without imaging, right? And you need to know that because that's super important. The other thing you need to say is, look, I have a copay, so or I may have a deductible. I need you to send me to the most affordable place for the imaging with the lowest cost, the lowest copay, or lowest total cost. So, for example, I can send a patient to get an MRI series of the knee, and that might cost $425. But your doctor might bill you for $2,500 for the same thing. Or they're not sending you to the facility that has the best price. So I'm going to say, make sure your doctor is sending you to the place where you're getting the best value for your dollar. Okay, so the pearl in download number 7 is to be educated about imaging and to understand that you have a choice. You do not have to do it. Your doctor should be able to diagnose you without imaging, and that if imaging you feel is really required between you and your doctor, hopefully you can get it done for a lower cost or a lower copay. My name is Dr. Forrester Dean, and I look forward to helping you with the next download.